There are very few centres in the UK that specialise in treating patients with PoTs, and we realised this a few years ago. I first started my job as Arrhythmia Care Coordinator in 2007, and within a few months had been asked to work within the nurse-led blackout service, which meant seeing patients when they were first referred to cardiology with blackouts. I realised that there were patients being seen in that clinic with PoTs, and it became apparent as I worked more within the service that there were lots of patients with PoTs within our centre. And so we decided that it would be a good idea to get all these patients to be seen in a clinic together. So in 2009 we started our PoTs clinic. It initially ran once a month and now it runs every week. The PoTs clinic in Sheffield is different to other clinics, I think, at the moment. We only see patients with PoTs in our PoTs clinic. I think other centres will see a mixture of patients with blackouts and autonomic dysfunctions, although I can't be certain of that. The blackouts clinics usually see a mix of patients who've presented to the hospital or have been referred from GPs with blackouts, and those blackouts could be due to epilepsy, they could be due to reflex syncope, or they could be due to cardiac arrhythmias. So this is very, very specialised. So these patients get seen and offered advice and treatment in that clinic. Okay, so when the patient comes to the PoTs clinic, they will be asked a lot about their history and their symptoms, and they'll be asked that while they're lying down, and that's because we need to do something called an active stand test, which involves taking the blood pressure whilst they're lying down, but also taking the blood pressure while they're standing up, and also taking the heart rate while they're lying down and standing up. And we also look at the patient's feet to observe to see whether the feet become mottled and red, which is represents venous pooling, and we also look at the patient's joints to see whether they're hypermobile. After we've done all this and taken a very detailed history, then we will order investigations. We need to ensure that patients with these symptoms haven't got something else going on that can give those symptoms before we diagnose PoTs. So we like to see an ECG, we like a heart scan, we like a 24-hour Holter monitor. We always like a tilt table test unless there's been one done elsewhere which is a good quality and it's been reported adequately. Some centres don't look for PoTs on their tilt table tests. Other tests that we like to know are the patient's UNEs, which is the blood salts, whether the patient's anemic, the thyroid function tests, vitamin B12, folate and ferritin, and we also perform 24-hour urine samples for catecholamines, metanephrines and 5-HIAA, and we also ask the patients for a 24-hour urine for sodium to see how much salt they're taking. There may be other tests that we require, but they're generally the ones which we will ask for. If they've been done in other centres, we won't repeat them. We'll get our very efficient clerical staff to get them for us. So the main aim of our PoTs clinic is to improve patients' quality of life. We will give them lifestyle advice initially, and this would include asking them to drink more fluids. We find that a lot of patients don't drink a lot of fluids, so at least 2 litres of clear fluid a day. We'll ask them to increase their salt intake. Some patients have already done this, and we find that some patients have adapted and have realised that salt makes them feel better. We'll ask the patient what they're eating. Are they eating regular meals? Are they eating breakfast? So getting the diet sorted out so they're eating 3 meals a day or small snacks. We ask them about exercise, and we recommend exercise according to how unwell they feel. So some patients may be able to go to the gym and do exercise, but some patients that might be a real problem, and so we'll advise them about exercise perhaps they can do at home to make them feel a little bit better. Walking, swimming. Patients with joint hypermobility, we would recommend they also do Pilates for core muscle stability. Other things that we would recommend are that patients don't drink any alcohol because it's very dehydrating, and for some patients we would recommend they cut out caffeine. Some patients that seems to help. So we also give them advice about if they get an episode where they feel dizzy or feel like they're going to lose consciousness, how to avoid that, how to deal with it when it happens. And some patients we suggest that they sleep with the head of the bed elevated, and we just give general advice about avoiding precipitating factors such as hot environments, standing too long in a queue, things like that.